The World Health Organization, WHO, has officially declared a rapidly accelerating Ebola outbreak in Central Africa a public health emergency of international concern. The declaration followed a tense, extraordinary virtual session convened by the UN Health Agency's International Advisory Panel, triggered by a highly alarming spike in fatalities and rapid cross-border transmission documented over the preceding 48 hours. The current crisis is uniquely dangerous because it is driven entirely by the Bundibugyo strain of the virus, a lineage that differs fundamentally from the more common Zaire strain. Public health authorities are treating this development with severe panic because, unlike the Zaire variant, there are currently no approved vaccines or targeted therapeutic treatments available globally for the Bundibugyo strain, presenting a catastrophic containment hurdle for international medical teams on the ground. According to internal epidemiological data released by the Democratic Republic of Congo, DRC, Health Ministry, at least 80 suspected deaths, 8 laboratory-confirmed cases, and 246 highly suspected symptomatic cases have been officially mapped across Ituri province, concentrating heavily in the dense, semi-urban hubs of Bunia, Rwampara, and Mongwalu. The emergency expanded internationally over the weekend when neighboring Uganda confirmed 2 separate, unlinked laboratory cases in its capital city of Kampala, both involving individuals who had recently crossed the land border from the DRC. Public health units are scrambling to trace these chains of transmission, but the task has been rendered nearly impossible due to the sheer mobility of the population. Furthermore, the WHO noted a high positivity rate in the initial batch of random field samples, indicating that the virus has likely established a much larger footprint than what local, underfunded clinics are currently catching and reporting. Compounding the biological threat is the heavily fragmented security and humanitarian framework of Eastern DRC, where active militant insurgencies and a massive network of informal healthcare facilities severely hinder tracking and isolation efforts. Tragically, the virus has already claimed the lives of at least 4 frontline healthcare workers in Ituri, signaling severe gaps in localized infection, prevention protocols, and triggering fears of widespread hospital-associated amplification. The WHO has officially advised all nations sharing land borders with the DRC to instantly activate their national disaster management frameworks, establish stringent screening protocols at international transit hubs, and scale up targeted risk communications to combat growing public misinformation. For a global community still structurally recovering from previous pandemics, the emergence of a highly lethal hemorrhagic fever with 0 existing vaccine stockpiles represents an extraordinary challenge that will require immediate, coordinated international financial and logistics interventions to prevent a broader continental disaster.